If you've noticed one leg or arm swelling more than the other, and it doesn't go away after a night's rest, this video is for you. It might be nothing. It might be fluid retention. It might be the weather. It might be that you sat too long in the car. But in some cases, it's your body trying to tell you something about a system most people never think about, the lymphatic system. And there's a diet connection that almost nobody explains clearly. Stay with me. Most of us grow up learning about the heart, the lungs, even the kidneys. Almost nobody teaches us about the lymphatic system, a quiet background network of vessels and nodes that runs alongside our blood vessels, draining excess fluid, filtering out waste, and supporting our immune defenses. Because it works silently, we don't notice it until something goes wrong. And when it does, the first sign is often something simple: swelling. A ring that suddenly feels tight, a shoe that doesn't fit the way it used to, one ankle a little puffier than the other by the end of the day. Many people brush this off. They blame the salt in dinner, the heat, or just getting older. Sometimes that's exactly what it is, but for a portion of older adults, this kind of swelling is the first visible sign of lymphedema, a condition where lymph fluid isn't draining properly and begins to build up in the tissues. As we age, several things change quietly in the background. Blood vessels and lymph vessels can lose some of their elasticity. Valves inside these vessels, which normally keep fluid moving in one direction, can become less efficient. Muscle mass, which actually helps pump lymph fluid through the body during movement, tends to decrease if we're less active than we used to be. On top of that, many older adults have had some kind of surgery, injury, infection, or radiation treatment at some point in life, including procedures completely unrelated to cancer, like joint replacements or vein surgeries that can affect nearby lymph nodes or vessels. Even certain long-term health conditions can put extra strain on this system. None of this means swelling automatically equals a serious problem, but it does mean the lymphatic system deserves more attention after 60 than most people give it. Let's talk about what to actually look for, because vague fear doesn't help anyone. Clarity does. Swelling that's one-sided. If one arm or one leg is noticeably larger, heavier, or more swollen than the other, and this persists for more than a few days, it's worth paying attention to. Harmless causes exist too: a minor injury, a bug bite, or simply favoring one side after activity. But persistence is the key detail. A feeling of heaviness or tightness. Some people describe it as their sleeve or pant leg suddenly fitting differently, or their skin feeling stretched. This can also happen with normal fluid retention. So on its own, it isn't alarming, but combined with other signs, it's worth noting. Skin changes. This might include skin that feels thicker, firmer, or doesn't spring back quickly when pressed. Again, dry skin or mild irritation from other causes can look similar, so this is a piece of a bigger picture, not a standalone red flag. Reduced range of motion. If swelling in a limb starts to make it harder to fully bend a knee, elbow, or wrist, that's a sign worth discussing with a healthcare provider, since it may point to fluid buildup affecting the joint area. Recurring skin infections in the same limb. This is less common but worth mentioning, because lymph fluid buildup can sometimes make skin more vulnerable to infection in that specific area. To be clear, none of these signs alone confirms lymphedema. Heart conditions, kidney function, vein problems, certain medications, and simple lifestyle factors can all cause similar swelling. That's exactly why a proper evaluation matters more than guessing at home. Here's where things get interesting. Most people think of lymphedema as something that only happens after cancer treatment, particularly after lymph node removal during breast cancer surgery. That connection is real and well documented. But it's not the whole story. There's a second, quieter category, something called chronic venous insufficiency, combined with long-term inactivity, obesity, or unmanaged swelling, which over time can overload the lymphatic system even without any history of cancer or surgery. In other words, lymphedema-like symptoms can develop gradually from decades of small, everyday factors piling up, not from one dramatic medical event. This is the part almost nobody explains on senior health channels. It's not always about what happened to you. Sometimes it's about how the body has been functioning day after day for years. Think of your circulatory system as a two-way street. Blood flows out from the heart through arteries, delivers oxygen and nutrients, and then needs to return. Most of it returns through veins, but a portion of the fluid that leaks out of tiny blood vessels into your tissues doesn't go back through veins. It gets picked up by a separate, smaller network, the lymphatic system. Picture thousands of tiny drainage channels, like a network of small creeks feeding into rivers, all working to carry that extra fluid, along with waste products and immune cells, back toward the chest, where it eventually rejoins the bloodstream. Unlike your heart, this system doesn't have its own powerful pump. It relies heavily on movement, especially muscle contractions from walking, stretching, and everyday activity, to keep fluid moving along. That's a crucial detail because it explains why inactivity can quietly contribute to fluid buildup over time, and why gentle movement is often part of managing it. When something disrupts this drainage, whether it's a blocked or removed lymph node, weakened vessel walls, or simply years of reduced circulation, fluid can start to pool in the tissues instead of draining away. That pooling is what shows up as visible swelling. Now let's get to the part in the title, diet. This isn't about a miracle food or a detox. It's about understanding how what you eat and drink interacts with a system that's already working hard to keep fluid moving. Sodium. High sodium intake causes the body to retain more water in the tissues, which can make existing lymphatic drainage problems more noticeable. This doesn't mean salt causes lymphedema, but for someone whose lymphatic system is already under strain, a very high sodium diet can make swelling worse. Protein. This one surprises people. Lymph fluid actually carries protein, and in cases of lymphedema, protein-rich fluid can accumulate in tissue. Some people mistakenly believe cutting protein from their diet will help, but doing so can actually be harmful, since the body still needs adequate protein for tissue repair and muscle strength. This is a conversation to have with a doctor or dietitian, not something to guess at alone. Hydration. It sounds counterintuitive, but chronic dehydration can sometimes make the body hold on to more fluid, not less, as a protective response. Staying appropriately hydrated, not overdoing it, just staying consistent, supports normal fluid balance. Body weight and inflammation. Carrying excess weight puts additional pressure on lymph vessels, particularly in the legs, and can contribute to inflammation that makes fluid management harder for the body. A balanced, whole food diet that supports a healthy weight can ease some of that burden over time, but this is a gradual, long-term factor, not a quick fix. Alcohol and processed foods. These can contribute to inflammation and water retention in some people. Reducing them isn't a cure, but it's a reasonable, low-risk habit that supports overall circulatory health. The honest reality is this: no specific diet reverses lymphedema on its own, but a diet that's mindful of sodium, adequate in protein, supportive of a healthy weight, and generally anti-inflammatory can meaningfully ease the daily burden on your lymphatic system. Beyond diet, several everyday factors influence how well your lymphatic system functions. Movement, regular, gentle activity. Walking, swimming, light stretching helps the muscles pump lymph fluid along its natural pathways. Sitting for long periods, long stretches without moving, especially with legs bent or crossed, can slow fluid return from the lower body. Sleep position and elevation. Elevating a swollen limb slightly, when comfortable, can support drainage. Tight clothing or jewelry. Anything that restricts circulation in a limb, tight socks, rings, watch bands, can worsen localized swelling. Certain medications, some blood pressure medications, steroids, and anti-inflammatory drugs, can contribute to fluid retention as a side effect. This is not a reason to stop any prescribed medication. It's a reason to mention swelling to your prescribing doctor, who can evaluate whether an adjustment is appropriate. The good news is that most of the reasonable steps here are low risk and genuinely helpful. Whether or not swelling turns out to be lymphedema, stay as physically active as your body comfortably allows, even if that just means short daily walks. Aim for a balanced diet with moderate sodium and adequate protein. Stay consistently hydrated throughout the day. Elevate a swollen limb when resting if it's comfortable to do so. Keep a simple written or photo log of any swelling, when it happens, how long it lasts, and what seems to help or worsen it. This kind of record is genuinely useful for a doctor. Avoid tight clothing or accessories on the affected limb. Keep up with regular medical checkups, especially if you have a history of cancer treatment, vein problems, or heart or kidney conditions. Some situations call for prompt medical attention rather than a wait-and-see approach. Sudden, significant swelling in one limb, especially if it's painful, red, or warm to the touch. This combination can sometimes indicate a blood clot, which needs urgent evaluation. Swelling accompanied by shortness of breath or chest pain, seek emergency care immediately. Fever along with swelling and redness, which could indicate an infection. Swelling that steadily worsens over days or weeks without an obvious cause. Skin that becomes hard, discolored, or begins to break down. For all of these, please don't wait it out or try to self-diagnose. A doctor can run simple tests and rule out more serious causes far more reliably than any home guess. Myth: lymphedema only happens to cancer patients. Reality: while cancer treatment is a well-known cause, lymphedema and lymphedema-like swelling can also develop from vein problems, obesity, inactivity, infections, or simply from the gradual effects of aging on the circulatory system. Myth: if I just drink less water, the swelling will go away. Reality: cutting back on fluids can sometimes make the body retain more water, not less. Consistent, moderate hydration is generally more helpful than restriction. Myth: compression stockings or sleeves are only for severe cases. Reality: when recommended by a healthcare provider, compression garments are often most effective when used early and consistently, not as a last resort. The single biggest mistake many older adults make with swelling is this: they wait. They assume it's just age, just salt, just a long day on their feet, and by the time they mention it to a doctor, months or even years have passed. Lymphedema and related conditions are almost always easier to manage the earlier they're addressed. Waiting doesn't make the decision easier, it usually just makes the swelling harder to reverse. So here's what matters. Occasional mild swelling is common and usually harmless, but persistent, one-sided swelling, especially combined with heaviness, skin changes, or reduced movement, deserves a conversation with your doctor, not a guess. Diet plays a real supporting role. Moderate sodium, adequate protein, good hydration, and a healthy weight can genuinely ease the load on your lymphatic system, even though no food or supplement can cure lymphedema on its own. And the everyday habits, movement, elevation, avoiding tight clothing, matter more than most people realize. This video is meant to inform, not to diagnose. Only a healthcare professional who can examine you, review your history, and run appropriate tests can tell you what's really going on in your specific case. Your body has been quietly working for you every single day for decades. The lymphatic system is one of the parts we rarely think about until it asks for a little help. Paying attention to swelling isn't about fear. It's about respect for a body that has carried you this far, and giving it the small, steady support it needs to keep doing so. Watch for the signs, take care of the daily habits within your control, and don't hesitate to bring anything unusual to your doctor. That's not overreacting. That's simply taking care of yourself. This video is for educational purposes only and does not replace professional medical advice, diagnosis, or treatment. Always consult a qualified healthcare provider about any symptoms or health concerns.